Knock, knock, knock. Provide privacy. Hi, my name is Shannon. I'm your student nurse today. We're going to be doing a head-to-toe assessment. Can you tell me your name and date of birth?
Rowan Croft, 3297.
All right, I'm going to clean my hands, check your wristband, make sure that it matches. Can you tell me why you're here?
I fell and hurt my hip.
Okay. And do you know where you are?
I am at Century Hospital.
And what day of the week is it?
It is Monday.
Okay, we're gonna do a full set of vital signs, temperature, heart rate, respiratory rate, blood pressure, pain scale. So tell me about that hip pain on a scale of 1 to 10. How bad is it?
It's like a 2, so I'm
Okay.
laying down.
Have you taken anything for your pain?
I took some acetaminophen.
Does anything make your pain worse?
Yeah, standing for a long period.
Has anything made your pain better?
Yeah, if I'm walking or sitting.
Okay. So then my hands are clean. Is it okay if I start doing my assessment? I'm gonna start at your head and work my way to your
Go
feet.
ahead.
Just lay down. All right, so first just inspecting. Patient is clean and well dressed, appears to be well nourished. I'm gonna start feeling your head, looking for abrasions, bumps, anything like that. I'm gonna feel in your neck, no lymph nodes. We're gonna feel carotid pulses, once on each side. I'm gonna feel your temporal pulses. Those are equal. And then, Rowan, can I have you just stare straight ahead for me? I'm just gonna shine a bright light in your eyes. Good. Go ahead and focus on something on the wall out there, and then look at my pen. Good. Pupils react. I'm gonna have you follow the end of my pen for me, just with your eyeballs, not your head. Good. And then last test here, I'm gonna have you tell me when you see my pen come into vision.
Yep.
Same thing on this side.
Yep.
Good. Pupils equal round react to light and accommodate. And our pupil size is about 6 right now. So, I know, right? And then if you can take your mask down for me. I'm just gonna look in the nose, open your mouth and say, ah. Good, mucous membranes are pink and moist. Teeth appear to be intact. Are you having any shortness of breath, cough, anything like that?
Nope.
Okay, I'm gonna listen to your lung sounds. So every time I move my stethoscope, I just want you to take a deep breath for me. So I'm starting above the clavicles, listening to bronchial. And then in the first intercostal space and second intercostal space are bronchial vesicular sounds. And then anything down after that is going to be vesicular. Alright, and then I'm going to have you go ahead and sit forward. I'm going to listen to your lung sounds on your back. We can provide a pillow for you.
I'll go pillow.
And inspecting the skin again, looking for any bruises, abrasions, asymmetry, anything like that. The upper lobes that we're listening to are bronchiovesicular sounds. And then anything lower than that is going to be vesicular. I'll help you put your pillow back. And you can go ahead and lay back again for me. So now I'm just going to listen to your heart sounds. You can breathe normally through this part. So we're going to start on the right side of the sternum, second intercostal space, listening to the aortic. On the second intercostal space, left sternum, we're listening to the pulmonic. On the fifth intercostal space on the left of the sternum, we're listening to the tricuspid. And then on the fifth intercostal space, midclavicular, we're listening for the apical or mitral. I'm hearing S1 and S2 sounds in all fields. S1 is going to be louder on the bottom, whereas S2 is louder on the top. We're gonna expose her abdomen. And I'm looking for symmetry.
Surprise. A second shirt.
Looking for symmetry, any bruising, masses, abrasions, anything abnormal. I'm gonna go ahead and listen to her bowel sounds starting in the right lower quadrant. Listening up to 30 seconds into each field. And we have all sounds throughout. I'm just gonna push on your stomach for a second. Tell me if anything is painful. Abdomen is soft, non-tender. All right, you can go ahead and put your feet back down. Any problems with urinating, any burning, urgency, frequency?
No problem.
How about bowel habits? Has that been normal for you?
No issue.
Okay. All right. And then we would inspect the perineum area if needed. I'm gonna feel my patient's femoral pulses. And those are equal. I'm gonna feel popliteal pulses behind her knee. Legs would be exposed. We're looking at the skin, checking for edema. We're looking for bruising, any discoloration, redness, warmth, anything like that. We're gonna feel pulses in the feet, equal on both sides. Socks would be off. I'm gonna check for cap refill in the toes. It is less than 3 seconds. Go ahead and push down on my hands and then pull up. Good. Go ahead, close your eyes. Can you feel me touching?
Yep, left,
Can you feel me touching?
right.
Does it feel the same on both sides? Good. Are you okay to come sit on the edge of the bed for me?
Sure.
Any dizziness with the change of movement?
No.
Feel steady on your feet?
Good. Yep.
Okay. Go ahead and walk towards the door and then come back towards me. Gait is equal. Go ahead, have a seat. You can go ahead and lay back. All right. Clean my hands since we were touching her feet. And then I'm gonna feel for brachial pulses and radial pulses. I'm gonna check CMS in the fingers. Cap refill. Go ahead, squeeze my fingers for me. Good. And then go ahead, put your arm up. Pull. And then push. Good. Same thing here. Push. Pull. Good. Go ahead and lay your head back and close your eyes. Can you put your arms out straight in front of you with the palms up? Perfect. Go ahead, relax. And then keep your eyes closed for me. Can you feel me touching?
Yep.
Right or left?
Left. Right.
And does that feel equal on both sides? Good. And I think I'm done. Do my room check. Room check. Thanks.